So it gives us a great pleasure to commemorate the National Epilepsy Day. Epilepsy is a very common phenomena, and almost 2% of the Indian population today are suffering from the disease. Today we have an expert with us. Dr. Suryanarayana Sharma is equipped with a DM in Neurology from the prestigious MS Ramaya Institute of Medical Sciences. He is working as a senior consultant in the Apollo hospitals. In addition to all this, Dr. Suryanarayan Sharma is an avid writer and has written a number of books in the vernacular language, that is Kannada, for the layman to understand some of the neurological issues, to make them understand the pros and cons of various neurological conditions. Dr. Suryanarayan Sharma also has a charitable institute called the Pattangare Trust, and this institute or institution is doing a lot of work in creating awareness on various diseases and also conducting various camps. One such endeavor we had an opportunity to work with was during COVID, where he did a lot of work on COVID management, and particularly he moved into the interiors and helped a lot of patients who were suffering from the disease then. So over to the expert. So sir, my first question to you is, what would you like to tell our viewers about epilepsy? What are the myths and what are the facts of epilepsy?
Good evening. I am Dr. Suryanarayana Sharma. Thank you very much for having me here in this podcast. Most importantly, epilepsy is one of the common neurological conditions which has a lot of stigma. So, as Mr. Ganeshan said, more than 1.5 to 2% of Indian population. At any point of time, more than 1 crore people are suffering from epilepsy at any point in India. So it's a big number. In urban localities, it is slightly less, but in rural, it is much higher. So we need to be aware about epilepsy. So what is epilepsy? Basically, epilepsy is a brain condition wherein there is an abnormal hypersynchronous discharge of the electrical activity of the brain. Basically, imagine the neurons or the brain cells are firing like electric wire. Brain is like a ball of electric wires. So by any reason, if there is a short circuit happening or if there is a sudden surge of electricity happening, that will lead to the clinical manifestation, what is called seizure. So if this seizure happens repeatedly due to a particular disease, which we will come later, so that can cause this epilepsy. Now coming to the myths and facts about epilepsy. Myths are there, deep rooted in our society. Unfortunately, even at the policymaker level, even at the government level, there was so much stigma that in 1956 Hindu Marriage and Divorce Act, epilepsy was considered as one of the legal ground for divorce. So the neurology bodies, led by Dr. H.P. Srinivas, who is a senior neurologist here, we had to move to Supreme Court and we had to move to the Parliament to make the amendment which happened in 1999. So you can just imagine what is the myth, what is there in epilepsy. Everybody thinks any seizure is genetic. It is not so. Only a percentage of seizures are genetic. That is number one. Number two, what we think about epilepsy, it can happen from a newborn till probably octogenarian or even a nonagenarian till the death. The reasons are different. So we need to, number one, we need to go to a doctor. Don't try any of the myths. Suppose some people, if the patient is jerking, they sit on the body of the patient. They have caused fractures. We have treated that actually. And many a time they give keys, some metal item and all that. So don't do all that. Most importantly, when patient has seizures, you just ask the patient to make the patient lie down comfortably to one side. If patient is biting the tongue, probably put some towel or some soft item only in the between the teeth so that he doesn't bite, and most of the seizures stop within 1 minute.
Thank you, sir. My next question to you is there any early signs or something where you can identify that a person could have epilepsy? And secondly, what are the normal kind of tests, and how do you actually do epilepsy in layman terms so that they do understand what actually the neurologist is doing to them?
Yeah, most importantly, number one, how does the patient presents with epilepsy? The common thing what as a common man sees is somebody lying down on road, throwing a fit, having a lot of froth in the mouth, and unconscious. That is one part of the fit, what we call generalized tonic-clonic seizures. But there are many other types of fits. So sometimes what we call it as automatism or facial lip smacking behavior, doing like this, continuous lip chewing movements, doing continuous eye flickering of eye movements, or mouth getting twisted to one side. So, and sometimes they will have focal seizures like this, hand just keeps shaking, sometimes just face goes to one side, keeps going, and during that time probably patient may be conscious, but if it doesn't settle down, probably he passes into a state of unconsciousness, then he will pass out and it may become a generalized seizure. Sometimes some patients, we call it a reflex epilepsy. Reflex epilepsy is a term, suppose if the patient has a laughing, yawning, sometimes eating, or diving into a cold water, these all can trigger epilepsy. This is called as reflex epilepsy. But commonly what you identify as seizure, suppose somebody lying down on the road or in any public place, having jerky movements with tongue bite, sometimes they pass urine in the cloth, sometimes they pass motion, and they become unconscious for few minutes, after that they get up. So, and some patients will have abnormal some raising sensation from the stomach, and they say that I'll have some kind of a raising sensation from the epigastric region, and suddenly after that I don't know what has happened. So this is what some people present. Now suppose somebody has epilepsy or seizure, what are we going to do? Most important thing what helps a neurologist in diagnosing epilepsy is a detailed history taking. What has happened to the patient? Patients can faint for 101 reasons. Even if you stand in a hot weather, very commonly we all see in schools, they are standing in prayer or some function, they stand for 20-30 minutes and somebody faints. So that is not seizure actually, that is just like we call syncope. So temporarily there may be dehydration, there may be loss of blood supply to the brain. Even heart condition, suppose if there is a irregular heartbeat, patients faint. So syncope is different. So for us, we have to establish that it is a true seizure, it is not like syncope or anything. That is most important, which we elicit by the way of history. If there is any family history of seizures, if there is any drug intake, if patient had any fever or any other episode, if there is any head injury, if there is any past history of any neurological condition. These are all some of the common red flags what we look at, especially when we are doing the workup. Second, in patients with low sugar, diabetic patients, nobody is there at home, they didn't have food properly, or they took insulin and they vomited the food, whatever. Insulin acts, but there is no food in the stomach. So hypoglycemic seizure is very common, especially in elderly patients, those who are staying alone, it's very common. Low sodium. So these are all very common. Now once patient comes to emergency, what are we going to do? Number one, we stabilize the patient. Stabilizing means what? We ensure that patient is alive. Number one, if patient BP is crashing, we have to do everything to improve the BP and heart rate. If patient is having any respiratory distress, we should stabilize the breathing pattern and circulation. Give IV fluids, give injections so that patient becomes stable. That is most important. Now, if patient is having active seizure, there are a set of medications what we give at emergency level. Third, what are the tests we are going to do? Most importantly, do the sugar test at emergency level. If sugar is low, correct the sugar, and most of the time, we have seen patients having seizure at home patient is shifted to ambulance. Our emergency doctors check sugar, it is 35, and we give sugar as well as the seizure medicine. By the time they reach hospital, they are already sitting in ambulance. So these are all the situation, these are all treatable conditions, number one. Number two, there are other tests we need to do. You do a detailed hemogram, hemoglobin, sodium level is very important, calcium level is very important, total CPK is a muscle enzyme. Suppose if there is active seizure, muscle enzymes will be elevated, that we will check. Next comes the imaging. Whether CT scan or MRI is at the discretion of the neurologist. Suppose patient had a head injury, patient had fallen down, there is a bleeding from the head. So don't waste time. We just shift the patient to CT scan, ensure that there is no life-threatening situation. Now patient is all right, already had a seizure, now he is conscious, he is sitting in the bed. So we do a detailed study at this point. So everything depends on how patient presents with symptoms to the hospital. Next, after CT or MRI, if it shows something, we need to treat that. There may be tumor, there may be stroke, there may be brain infection, there may be head injury related findings on the imaging. So these are all common things what we see on an imaging. Next comes EEG. EEG is like ECG of the brain. How we do ECG for the heart, we do similarly EEG for the brain. So we attach leads at multiple designated points in the brain, and we take the recording. So based on the pattern what we fix, is it genetic seizure, is there any other source of infection, or is a particular part of the brain which is weak causing seizure, all that we come to know. And if patient is especially elderly, like I say above 40 years, a detailed cardiac examination is mandatory. Sometimes patient may have a heartbeat variation, he would have fainted and he would have thrown a seizure, we call it a syncopal seizure. So here we say neurologically everything is normal, and after 15 days he promptly comes back with same episode. So these are all some of the things what we need to keep in mind, especially when patient comes with seizure in an emergency department.
Thank you, sir.
Thank you, doctor, so much for the wonderful insights. Now, as you have discussed about stigma, so my question to you is, there are a lot of stigma around epilepsy, on pregnancy and marriages, which is actually very important for us. So could you suggest some useful insights to break the stigma on these important phases of life?
Yeah, both pregnancy and marriage is a very important phase in a life of a woman, as well as the whole family in which she is important member. Now there are a lot of stigmas what we face across in everyday life actually, and because of that lot of families are suffering and struggling. There are 2-3 important things what we need to consider, especially when a woman wants to conceive in her reproductive age group and she is already on anti-epileptic medicine. Most importantly, is it a familial fits? Familial. If there is a genetic component of fits, which is common in many conditions, so there are certain entities wherein the risk of seizure in the child or our newborn is also higher. So we need to keep the family updated about it. Now, there are various other types of seizure. A lady would have had a head injury and she would have been having seizure. A lady would have been having a brain infection, having seizure, had undergone some surgery for some other reason, having seizure, stroke with seizure. So these are all the entities which doesn't transmit to the offspring. So we need to give confidence to the women and also her husband and their family, so that they don't get scared and they will not have rift at a later point of time. But one important thing we need to keep in mind: don't hide the information that you have seizure and get married. I've seen a lot of divorces and breakups because they just say that no doctor, they didn't say that they had seizure in the past. Because in pregnancy, lady would have thrown a seizure and doctor would have said, yes, this seizure doesn't look like a first time seizure, it would have happened before. So our most important information or message to all the women in their reproductive age group, especially those who are awaiting marriage, they have to be opened up about this seizure. Many a time they bring their fiancés or those who are willing to marry, they come for a counseling. We do the counseling, we say fine, this is a genetic type of seizure, we have to accept this particular risk. And in many patients wherein there is a stroke, there is a CVT, the venous thrombosis, head injury related, brain fever related, we give them confidence that this is particularly only to this patient, it doesn't come to your child, so you can go ahead with the anti-epileptic medication and pregnancy. Now many a time what happens, we see the women already in first trimester or second trimester of pregnancy already on medication. Here there is a catch. There are some medicines which are not very safe. So earlier days, 20-30 years back, there was no data in India to prove that anti-epileptics are safe in pregnancy, and most of the doctors used to discourage women with seizures from having a child. So now things are much better. We have safer drugs, we have good drugs, efficacious drugs with less side effect, so that a woman can comfortably conceive. As every month I have at least 15 pregnant women with seizures who are on regular follow-ups. 94 to 96% of these women, if they follow medications properly, if they undergo anomaly scan at regular intervals prescribed by their doctor, and if they take medicine as per the body weight, so usually they pass through the pregnancy very smoothly. And especially most important, we need to keep in second or third trimester of pregnancy, their weight increases suddenly, so we need to optimize the dosage of medication. And during delivery also, we sometimes give injection so that they don't throw a fit and they deliver. After that we cut down the medicine. But now I am very sure it is quite safe for a woman in childbearing age with seizure to have a child. And also during marriage or before marriage, a premarital counseling is what we usually offer in most of the hospitals, and be open to your partner. That is the message what I would like to highlight here.
Thank you, doctor, so much for the wonderful insights. So my next question is, what kind of lifestyle changes or support system can make a real difference in the lives of people, both medically and emotionally?
Yeah, this is a very important area where we need to put a lot of effort. Not as an individual patient. Individual patient, you give medication and you send them and with basic instruction. But at a community level, as I already pointed out, stigma about epilepsy is very high. So that probably more and more awareness campaigns have to be done. Second, about lifestyle, what you highlighted rightly. Number one, patient with epilepsy, we need to give him little more information in his first or second visit. Now you say that fine, you have epilepsy, you need to be on medicine for 3 years, 5 years or lifelong based on the type of seizure. Now few important instructions this particular person has to follow. Most importantly, taking medication on time. The compliance to drug is very important. In various studies, 70% of the patients are non-compliant. So either they are not getting adequate dose, or they are missing the doses. We have seen patients faking that they take medicines, but later the relatives find that it is below the mattress or in the dustbin and all that. So they have to be serious about taking the medicine. That is number one. Compliance, taking time, right time. Suppose you have to fix a time, morning 8 to 9 you have to take the time, medication night 8 to 9, like that. So suppose if they are fasting for some religious reason, so they take in the afternoon and evening they come with seizure. Every drug will act for a particular time. It doesn't act just because you take one tablet, doesn't stay in the body for 48 hours. So there are medications which have a definite half-life. So that is very important, what we need to keep in mind. Second, sleeping on time. Sleep is the most important trigger for epilepsy, lack of sleep. There are various studies which have proved, especially in pilots and even in army men, wherein they have shown that 100 hours of lack of sleep as a part of their rigorous training has produced seizure in many of them. They are totally perfectly normal people. So sleep is very important. And sleep hygiene, we say, it is not like you sleep 7 hours every day. It doesn't work like that. You have to go to bed at the right time and you have to get up at the right time. That is very important. And especially when they go outside for a party or this one, many of them miss sleep and next day morning they come with seizure. So know your limitation. you have to sleep on time. That is important. Third thing is sometimes looking at flickering light and all that will trigger seizure. So you have to be very careful. Fourth is about driving. So driving, as per the Indian law, epilepsy patients are not permitted to drive. Many people don't know this. They have accidents and they'll end up in all the legal trouble. So if you have seizure, if you are on anti-epileptic medication without your doctors, please do not drive. It is not permitted as per law. And swimming, sometimes we call reflex epilepsy. They dive into water and they throw seizure and there is no help. Patients have been dead like that. So be very careful. Driving, swimming, lack of sleep, taking medication on time, and weight gain. Most of the anti-epileptic medication what we give on a daily basis, they are all weight dependent. The dosage is weight dependent. So even if a person gains like 5 to 8 kgs, so they may, the dosage may not be adequate. Again, doctors may have to increase the dose. In that time, patient may throw a seizure. So these are all some of the things what everybody should be aware of.
Thank you, sir. Thank you so much for the wonderful.
Thanks.
So, doctor, so what our viewers would like to know is that, say, as time passes by, anti-epileptic medications tend to get better in terms of treatment efficacy. So, our viewers would like to know how it improves their lives, and also since today's generation, particularly the youth, they are more career focused, more career oriented. So, how can they manage epilepsy in trying times like these? Is what we would like to know.
Yeah, that's a very important thing what everyone has to know. Most importantly, earlier days, the conventional anti-epileptic drugs what we were using, like phenytoin, phenobarbital, carbamazepine, they were all really good drugs, there is no doubt. But the side effect profile was very high actually. Number one, they used to have a lot of facial dysmorphism, liver issues, blood hemoglobin and other blood cell line production issues, and they used to have anemia, they used to have memory loss, they used to have balance issues, and cognitive issue was very significant. So because of that, the lifestyle of an epileptic patient was miserable actually, I would say. Many patients used to stop taking medication because of side effect. And there is a entity called Steven-Johnson syndrome, which is like a life-threatening skin allergy, which was very common with the conventional anti-epileptic drugs. So that was quite common, and that was any epileptic patient's professional career was really affected because of that. But now, after maybe 2000, lot of invention has happened, lot of research has happened in the pharmaceutical industry, lot of good drugs have come. Probably levetiracetam, brivaracetam, then clobazam, even all the newer medications. I won't go into the particular details of the medicines. Now they are very safe. Number one, the side effect profile is very much lesser. The allergy or anaphylactic shock reactions are much lesser because the production standards have become much higher. Most of the Indian pharmaceutical industries follow the global standard now. So there is no, the contamination risk is also much lesser. So definitely the drugs are very safe, efficacious, and side effect free, and also compliance is much better with the patients. Now you can, a patient, suppose I just give an example, a college student, 18-year-old college student develops a seizure. So if MRI is normal, if EEG is normal, if most of the workup is normal, I can assure that you take anti-epileptic medication, your intellectual or IQ or your exam performance will not get affected. Probably you may do better than the other guy next to you. That confidence we can give now because of a good medicine and the safe medicine, effective medicine. So the conventional drugs what we used to give, we couldn't give that much assurance to a patient. Now women with pregnancy, they are able to conceive, they are able to deliver normal babies. Every month, as I said, I have at least 15 to 20 deliveries. My patients undergo 15 to 20 of my patients deliver healthy normal babies. So now it has definitely affected or impacted the lifestyle of a patient. If you know some of our patients who are on anti-epileptic medication for 8 years, 10 years. They just come and sit next to me. You can't even recognize they are taking fits medicine. So there is no, only thing what they need is little confidence, number one, and periodic checkup as per the doctor's suggestion. These two they need. Otherwise, most of the drugs, the modern drugs what are there, which have been in the market for last 15-20 years, most of them are very safe, and probably first 3 months when we initiate, we'll be little careful, because some drugs suit some patients, some drugs don't suit, and some drugs, if patient has recurrence of seizures with those medicine, probably we may have to change. But first 3 to 6 months, if a patient tolerates the medicine well, probably they are the patients, who will do very well. And don't get scared. You have, see, it's your life is very precious. We all live only once, right? And if you have seizure, go to a doctor. Don't believe somebody's story. Hearsay evidences should be ignored. Number one, please do not follow the myths what we had. Epilepsy is no more a social stigma. There are many celebrities who have come out open with, we had seizure, we are on medication. It is not a social stigma anymore. Government is supporting, and even the hospital doctors are very supportive to the epileptic patients. So only thing what you need is more confidence, number one, and number two, compliance. Drug compliance is very important, because suppose I tell you that I have to give you medicine for 3 years. You take medicine for 2 years, then you stop for 1 week or whatever reason, then you throw one more seizure, then you have to take medicine for 3 years more. So the timeline what was there 2022 November, because you didn't take medicine properly, it has pushed to again another 3 years like 2028. So don't take medicine, don't stop medicine. And another important thing, you may get admitted for some other disease, like you may have a gallbladder surgery, you may have a hernia surgery, you may have a cesarean or a hysterectomy. You have to inform your surgeon or your treating doctor that, sir, I am taking fits medicine. What to do? So they will inform the neurologist. We give injections sometimes because surgical risk or surgery is a stress for the patient, and we pull them out. So all these finer things, smaller thing, it may look very small, but for an individual patient it's a big thing. So never have stigma, never learn the facts about epilepsy. That is most important, and be brave. You can fight epilepsy better. Thank you.
Thank you very much, Doctor, for your kind feedback.
Thank you, sir.
At the outset, I would like to thank Dr. Suryanarayana Sharma for having spared us very valuable time out of his busy schedule, and enlightening all of us and the viewers on nuances of management of epilepsy. So thanks a lot, Doctor. I'm sure, and I'm very sure all our patients of epilepsy will be thoroughly benefited, and they would use the tips for managing their lifestyle much better. Thanks a lot, sir. Thank you very much.
Thank you for calling me. Thank you very much.